Hello, I am Dr. Chandrika HS, practicing as an obstetrician and gynecologist at Chirag Hospital, P Nagar Phase. Well, having two cesareans is not a major thing because nowadays plenty of mothers are having two cesareans because cesarean has become the way of delivery more common these days. It will not have so much effect on the hormone levels because that is normal. Any mother, whatever happens, it happens the same thing because 2 times cesarean is not a very stressful thing. And it cannot produce too much of changes in the hormones. This will happen as it happens in any other delivered mother because it can happen in a person who has delivered vaginally also. So only thing is, do you think that because you have undergone cesarean it may be painful? It is not true because by the time you are slowly passing that postpartum period, your incised area or the wound of the cesarean will recover very much fast and you will not have any pain. Even when you are admitted in the hospital only you can see that first post-operative day it will be little painful, second day it will have reduced, and by the time you are discharged from the hospital most of the patients will not have any pain in the cesarean incision area. So you need not bother that you have undergone 2 cesareans and it will affect this thing. And when you have delivered, whatever happens to a normal delivery person, the same thing happens regarding lactation, production of prolactin and those changes which can have some effect on the routine hormones estrogen and progesterone. So there will not be much change in the people who have undergone cesarean provided they do not have any problems due to the cesarean, that is the technical problems of the operation. There are multiple cesarean sections because routinely what we do is 2 cesarean section is a very common thing. So if it is multiple cesarean sections, sometimes they want to have more children. So they are forced to have, because once you have done cesarean, most of the obstetricians prefer to have a repeat cesarean only. So 2 cesarean is a quite common thing. But there are some ladies who want to have more children, more people who are bothered about sex of the child. See, suppose they have got 2 female children after 2 cesareans, the family wants to have 1 male, and because of that they conceive again, and they will not bother to repeatedly conceive to have more children. Some people it is due to want of having more children. Some people it is due to selection of what sex of the child they want. So that time the number of cesareans will increase, and if the number of cesareans increase, there will be a little bit effect on the mother because it is already a scarred uterus, and doing repeated cesareans may not heal the uterus more nicely as it will happen in 1 or 2 cesareans. So that is one major change that can happen in repeated cesareans. But the hormonal changes also can happen more because repeated deliveries may not be, the mother may not be able to face the challenge, and that may be one of the reasons. Otherwise, not that usually after cesarean, not that there will be any pain or something, but usually what happens is if you are doing repeated cesareans, there will be something which happens inside the body, that is inside the pelvis. There will be some adhesions of the different organs near the cesarean scar and near the abdominal scar and all those things. These things may have effect on the intestines and abdominal organs. Because of this effect, there may be some nagging pains, some intestinal pains, some things may happen. And sometimes what happens is because of repeated cesareans, the bladder position also will change because the bladder will be adjacent to the uterus, in front of the uterus. And when they do repeated cesareans, what happens is the bladder each time it can raise up, means it can raise up from its routine pelvic position, it can go more and more towards the abdomen. When this happens, the capacity of the bladder to control the urine for a long time will reduce. So that will be urge incontinence because the mothers cannot control urine for a long time. So they may feel like voiding the urine more frequently. These are some of the causes that can happen in repeated cesareans. But most of the time, if the doing surgeon has done it very neatly, there may be chances that nothing at all will happen, and they will be as normal as any normal cesarean mothers. I feel there is no need for you to watch for any hormonal imbalance after cesarean. Most important thing is after cesarean, you have to lactate and you have to look after your child. And after some months, naturally your periods it will start regularly.